Hi, everybody. Sorry, I didn't know I was muted earlier. Welcome to the Meet a Changemaker live podcast recording. It's good to see everyone. Hi, guys. We have five people in the audience. We have five participants already. And let's just give a bit more time for other people to join in. And of course, we're still waiting for Deborah to join in as well. So let's just wait a couple more minutes before we start. Before we... Oh yeah, Deborah is here. Hi Deborah.
Hi,
We meet. Oh, welcome to the call.
thank you.
Yeah. So we just said that would give a couple more minutes for other participants to join in, then we can start. We currently just have five people in the audience, so we can't see them, but they can see us. And please, if you can, if you're in the audience and you can't hear us, please just indicate in the chat box. There's a chat box for you to engage. And you can also send in your questions through the chat box. Okay. Okay. So we start at 2:05. Thank you.
Hello, everyone. Some reason I can't hear. Oh, okay. I can hear now. Hello, everyone, and welcome to Meet a Changemaker live podcast. My name is Ohanu Dabriolokije, and I am a program coordinator here at Nigeria Health Watch. I just want to confirm that everyone can hear me. Okay, welcome everyone. And again, this is Meet a Change Maker live podcast. I'm really excited to be the one introducing this very beautiful platform to everyone in the audience. My name is Dabri again, and I am a program coordinator here at Nigeria Health Watch. For most of you who don't know what Nigeria Health Watch is, we're a health and communications and media advocacy organization. So we use these various tools, communication tools, to really inform Nigerians about what's going on in the health sector. But not only that, we also raise awareness about what's going on in the health sector for policymakers and decision makers as well. We do this through our various means, so editorial, where we write articles on solution stories, and we do this through social media, the events we convene, and we also do this through the projects that we implement. And one of such projects is the Solutions Journalism Africa Initiative project, which is the main reason why we're here today. The mindset of Solutions Journalism Africa Initiative project, or SOJO, is just really to shift the mindset from focusing on problems and try and focus on solutions. So in the first phase, we had worked with journalists to produce stories. And in this second phase, we're working across five objectives. So, working with community radio stations, working with institutions to deepen the practice of solutions journalism, but we're also working on inclusive training content so that we can be able to spread solutions journalism to a wider audience in a way that is easily accessible to them. And in so doing, one of our objectives also is to work with mentors and our media organizations so that they can produce more quality stories. Um, One of our objectives, again, as well, is this one that we are on, which is the Solutions Journalism Knowledge Exchange. The objective really seeks to continue integrating solutions journalism training and just really um, create a platform for people and journalists to network and to share solutions journalism and to share solution stories. During the first phase of the project, we had a situation where journalists had come to see that they weren't able to get solution stories, or they weren't able to get solutions like story ideas. So this Meet a Change Maker is just one of those platforms where we've created so that journalists can come and meet those people that are implementing these solutions, and they can converse with them and hear from them, and hopefully that way they can write stories from the conversation. And the Meet a Change Maker is a live podcast, and um, okay. Okay, I think I'm back on. So this is an engagement, so where we can have like journalists come to converse with the change makers who are on the call. I'm just going to pause here and I'll introduce the Solution Journalism Africa Initiative manager, Caroline Carubia. She's going to say a few words to us, and then we can continue the program. Hi, Caroline.
Hi, Dabri, and hi to everyone who has joined the session today. Apologies, I was having technical difficulties to join, but I'm really glad that I was able to join. And thank you for organizing this discussion. It's a really important discussion, as you've said, because this is all about solution journalism. Solution journalism is about finding solutions and solutions that matter to community. So I'm really excited to be here. I'm really excited to hear from our guests from Kenya, South Africa, and Nigeria on the changes they've initiated and made, and to also learn from them. And I'm also hoping that the journalists and the people who've joined as audience to listen in to this discussion are also going to get ideas on how they can go about it. So looking forward to the discussion. It's part of a project that we are working on under this second phase of the Solution Journalism Africa Initiative project, just looking at how we can exchange knowledge when it comes to solution journalism. So I'm really excited to be here.
Thank you very much, Caroline. And I'm super excited to announce that there's going to be a special announcement at the end of this live session. So everybody should stay tuned till then. At this point, I'm going to introduce our host for the session, Sonia. Sonia, please take it up from here. Thank you.
Okay, thank you very much, Dabri, and thank you so much, Caroline, for that word. My name is Sonia Biose. I am a programs officer at Nigeria Health Watch, and I will be your host for this podcast. So, with us, we have three amazing change makers, three amazing human beings who are championing different innovations in their communities across three different countries. and they are members of the Nguvu Collective. The Nguvu Collective is a group of innovators and change makers championing different varieties of solutions across various sectors in their communities. So, in no particular order, starting from the lady first, we have Deborah Monari. Deborah, please, can you turn on your video and just give us a wave? Deborah is a nurse in Kenya, and she's currently fighting, she's championing a campaign to eradicate the issue of misdiagnosis in the Kenyan health sector. Thank you so much, Deborah, for joining us. It's good to have you here. And then next we have Isoro from Nigeria. Itoro is a change. Itoro, just give us a wave if you don't mind, so they know who we're referring to. So Itoro is a change maker also within Google Collective, and he is a leading voice, advocating for HPV vaccination and eradication of cervical cancer in Nigeria. Cervical cancer amongst women in Nigeria. Thank you so much, Itoro, for joining this conversation today. And then next we have Innocent Madonsela. Please forgive me if I murdered your name. I hope I did not. We have Innocent. Innocent is from South Africa. And Innocent is also a change maker within Google Collective, and he is leading a campaign to eradicate the issue of teenage pregnancies and oh, I kept practicing that word, but I don't know. You know what I'm trying to say? I think it's Funelani Ngonane. I don't know if I got that right in South Africa. And it's good to have you here, Innocent. So good to have you, and I'm sure our audience are itching to know what you've been doing, and I'm sure they are eager to learn from the your innovations and the interventions that you're carrying out in your various communities. So we're just going to get straight to it, starting from you, Itoro. So sorry, I forgot to mention that Itoro. Yeah, I already mentioned that Itoro is championing a campaign to eradicate cervical cancer in Nigeria. So Itoro, we know that cervical cancer is among the leading cause of the second most frequent cancer amongst women in Nigeria, right, and probably globally. And then we also know that it's also the second most frequent cancer causing death in Nigeria. But then would like to know your story. Why did you decide to champion why HPV vaccination? Why cervical cancer? What's the story behind that? Over to you, Itoro.
Okay, thank you so much. So let me start by saying that the prevalence of cervical cancer remains a significant health challenge in low and middle income areas of the nation, just like you've mentioned. And the reason is as a result of limited access to awareness and also limited access to screening facilities. And mostly women in these regions are totally unaware of the importance of regular screening, and some do not have access to these facilities where they can get screened and of course avoid the plague of cervical cancer in the nearest future. So this happens, and usually you see that women are presented in hospitals when the cancer is already at a very advanced stage. And of course, at that level, the prognosis is usually not good. And this is what eventually lead to the high morbidity and the high mortality rate we're talking about. So let me share my personal story, which of course is very heartbreaking and very traumatic. Yeah, in 2016, my mom was diagnosed of cervical cancer, and just within the period of 7 months, we lost her. I watched my mom battle with cervical cancer. She gave her all. She fought. I remember she telling me that she was not going to die. She was going to come out of it. She kept telling me all that, and I believed that that was going to happen. But eventually, she succumbed to this monster killer. All right. So at that point, I was broken and really, really broken. And the truth is, several other women around this region, Africa as a whole, going through similar issues, similar challenges, and on record, over 12,000 women are diagnosed of cervical cancer annually here in Nigeria, over 8,000 deaths recorded. And stats also shows that over 36.6 million women of ages 15 and above, are at risk of having cervical cancer if we do not put the measures in place just to ensure that we curb this menace. So it was at that point Help the Woman campaign came into play. And basically, we came in to do four things, and I'd like to just run through that quickly. Number one is to create a comprehensive public health awareness about cervical cancer, and our target audience is actually the young girls and of course the women. And this we do by empowering them with the knowledge through educational initiatives that foster understanding about the risks of that is associated with this cancer, and of course, and how they can also take advantage of the screening. Secondly, we want to significantly increase the participation of women in screenings to detect precancerous lesions, because the truth is cervical cancer is totally preventable, but then it has to be detected early. But most women do not know about this. So we want to ensure that they take advantage of this, they participate in screening, they participate in vaccination. And next, we want to reduce cervical cancer rates by sensitizing these women and girls about healthy sexual behaviors. This is actually a sexually transmitted disease, and promoting HPV vaccines, just like we did throughout last year. And thank God Nigeria had rolled that out. Okay. And also, we want them to be treated for persons who are diagnosed, especially at the early stage. If treatment is offered immediately, timely intervention, so they could be saved from this menace. So we do that by collaborating with partner hospitals and agencies, just to ensure that we're giving these women the opportunity to it hurts when you know that this is actually preventable, but then you had to lose your mom, you had to lose your wife, you had to lose your sister, anybody close to this particular issue. So that's basically what we're doing. And of course, we're trusting that very soon we'll see the end of this. Thank you.
Thank you so much, Itoro. It's so hard to hear that story, knowing that your mom had to die um, as a result of cervical cancer. But I'm sure she's proud of you, knowing that you're championing a cause to make sure that no woman has to die of cervical cancer. And it's also worthy to know that, the HPV vaccine was introduced in October last year in Nigeria. And then we're also going to be having a second rollout in May. And it's all thanks to efforts by you and other bodies that have championed this cause, and we're truly grateful to you. So thank you very much for that. Over to you, Deborah. If you can please turn on your video. Before Deborah comes up, I would like to note that this session is also being streamed across our Nigeria Health Watch platforms on YouTube and Facebook. And if you're unable, or you know someone who is unable to join in on Riverside, they can as well stream on those platforms. So Deborah, what's your story? Why are you, sparked your interest to um lead this advocacy to end misdiagnosis in the Kenya health sector?
Okay,
And how
so
are you
hi,
doing it?
yeah,
Thank you.
hello. My name is Deborah. As you've heard. So what really was the push for me to get into this advocacy space for patients' rights was a personal experience with misdiagnosis and negligence in hospitals that happened, and I was getting dismissals. I was getting all sorts of ridiculous suggestions as to what was causing my symptoms. And after 6 months long of not getting any help, I finally had to go to India just to find out what was wrong with me. And underwent surgical and medical treatment for a brain tumor. So this experience made me just, look further and beyond my own personal experience, because I realized if this happened to me, and I'm a healthcare worker myself, I just wonder how many more people go through this and, perhaps even develop complications just due to the negligence that has been going on. And I noticed that there's a need to have official ways to report, get justice, and hold accountable healthcare workers who behave in this manner, really. And I noticed that some hospitals do have such channels for reporting. We have hotlines, we have offices for reporting, but it's not centralized. It's not official, or a requirement for that is regulated by the government. And I realized that if we have patients' rights committees in all healthcare institutions across the country, this would really help mitigate these challenges and help protect patients' rights, because then people have a clear channel for reporting, for solving issues, just to prevent escalation of such matters. So this is what brought me to advocacy space in the first place. And so I got interested and started looking at statistics. Um, for instance, in the year 2022, there were about 106 cases of negligence reported to the Kenya Medical Dentist Practitioner Council. Um, and these are just, the reported ones. Think about the unreported, which I believe are even, more than the reported cases. It's also shocking that 60% of negligence cases are obstetrics related. So all these statistics, also keeping in mind that there are no official statistics on these issues to show what happened after these things were reported, so that people can be able to track and see that action is really being done. This is why I saw it as a major problem in our country that needs to be addressed. Mm.
Audio was off. Thank you so much, Deborah, for that. It's sad to hear those experiences. We're glad that you're here, you're fine. Because I mean, one time is a mistake, twice, three times, and then eight times misdiagnosed. Wow, that's something, and it really means a lot that you saw that as an opportunity, to make sure that no one has to suffer the same experiences that you suffered. And as a nurse, I can imagine how that what that meant for you, right? Knowing that this has been happening all along, because I'm pretty sure you're not the first person that was misdiagnosed, but it's great that you saw that as an opportunity and you're championing that cause and you're leading the advocacy to ensure that not just that no one has to suffer similar experiences. And we hope that people on the call can learn from your story and carry out similar innovations in their own countries. Thank you so much, Deborah, for sharing that. So over to you, Innocent. Um, I already mentioned that you're leading an advocacy to end teenage pregnancies and to end, I'm pretty sure I will learn how to pronounce this word before the end of this conversation, and to end the practice of funelani nganeno in your community in South Africa. So would like you to just tell us what that is about. What does that even mean? And the statement of the problem and how you've been able to champion this in your community.
Thank you very much, Sonia, and to all the listeners. Um, so I teenage pregnancy because is the practice called funelani. Your girl child were to go missing, you
Hi,
can come
Innocent,
and
we can't
find
hear you. Your the audio is breaking. We can't really make out what you're saying.
her at my house. Meaning, can you hear me now?
that, but we didn't hear the first few sentences. Okay, Innocent, you can try turning off your video if that helps to stabilize the network. Okay, Innocent, I don't know, are you still there? He's frozen. Oh, and he's out of the call. Okay, so would sorry, I didn't know my video was off. So would just move on while we wait for Innocent to jump in on the call. So questions are already pouring in the chat box, and that would have been, so someone in the chat box already asked how you're doing it, and that would have been my next question. So Deborah, can you just describe tell us how you've been able to lead this advocacy campaign to end misdiagnosis in Kenya?
Yeah, certainly. So the first step, of course, was recognizing the need, and I had a picture of what would help, which is establishment of patients' rights committees in all healthcare institutions across Kenya. So the first thing I did was put up a petition um, demanding that the government establishes these committees in health institutions. Went ahead to garner votes from the public, to ensure support that people actually resonate with this. I've had a talk show called The Deborah Show, where I've interviewed a few people with stories of misdiagnosis themselves and stories of negligence. I recently put up a survey on obstetric violence, which is basically violation of rights during labor and delivery, which also falls under patients' rights. Um, in conjunction with two other change leaders, Harriet and Josephine, and we've gotten 185 responses of stories, people telling their stories on how their rights were violated in the hands of different healthcare workers. So apart from garnering public support and real-time evidence, pulling up statistics, I also reached out to key decision makers that I thought would be beneficial to reach out to. I requested for a meeting at the Cabinet Secretary for Health in Kenya, Honorable Susan Makunisha's office, and we were invited. I was invited to speak with her team. I had brought up this issue and the petition that showing the evidence that I had and what kind of support I really wanted. And we talked. The office of the cabinet secretary showed their support. There was a press release about it on kenyans.co.ke showing that the Ministry of Health actually is in support of ending this kind of negligence, but there's no one body that is in charge of, establishing long process to reach out to. So we've emailed the CEO of KMPDC to have a sit down with him, reaching out to several basically politicians. Talked to Honorable Muchomba, went to her office just to discuss this and gain as much support as I could, so that I can have insight on how this can be accomplished. Because such kind of establishment is not something I can do. I can only and get the government involved. So apart from this, I've also been able to reach out to several media houses for interviews and publications and articles. An example is the Daily Nation newspaper in Kenya, and got them to cover my story and what I'm doing, the petition that I'm running, is to get awareness out there for people to know what's happening and how they can support. I've also had other media houses publishing citizen Kenyans.co.k once again, Tuko News, etc., and interviews in some media houses like KBC Radio, um, Hope TV. So I've tried to do my advocacy not only in terms of online pushing, in terms of messages, social media, but also reaching out to various media houses because I know this is where the secret lies. You get as many people involved. As an advocate, you can do it on your own. So garnering and reaching out to the key decision makers is one way that I've really been using, and I noticed that we're getting somewhere. Yeah.
Okay. Thank you very much for that, Deborah. Jackson, I hope that answers your question as well. So, would you say that you have, or you've been able to get the support, right? Would you say you have political will? Have you been able to get the support of key decision makers for your advocacy?
So, in terms of support, I believe that the media has supported the politicians I've mentioned. The Honorable Wamuchomba, she's also working on OBV Heshimu Uzazi campaign. So she's also in the space of patients' rights and respecting the rights of patients while they're delivering. Um, so I see that as a support. Also with the CS office, they showed their support. But so far, I can't say that I've been able to garner the support that I really want, and because I've not seen any tangible um, result, like an establishment of an actual patients' rights committee, a model one that could be used to pilot, and roll out in other counties, the government. But I realize this might be a challenge because healthcare is devolved in Kenya. So getting to identify the single decision maker who will now actualize all these by themselves has been a challenge for me. But so far, I can say that I'm getting support, I'm getting word out there, and with more work and more support, I think I'll be able to garner the interest of the right decision makers in this space.
Thank you very much, Deborah. And we hope that from this call, we would have journalists that would be interested in writing about what you're doing and to amplify your efforts. And we hope we're able to get the change that we need to see in the Kenyan health sector. Um, so over to you, Itoro. Can you just similar to the earlier question I had asked Deborah, what exactly are you doing? What is your response like in your advocacy? How are you championing
Okay,
this
thank
cause?
you. Okay, thank you. Basically, when uh, we discovered this challenge, the first step we had to take was to conduct a research to understand our audience, understand their knowledge, their attitude, and of course, the barriers and why most person, because truth is, there are so many, uh, I'm echoing, sorry. Okay. All right. So there are so many persons, so many women who do not accept services. Sorry, I'm echoing.
So there's an echo, and yeah,
Okay,
there's
innocent. Maybe
even
you
an
should mute
echo
your
on my
mic.
end. Okay,
Okay, thank you.
okay.
All right. So let me recap. So we conduct research and we try to understand our target audience, their attitudes and the barriers, and of course, like most of their belief system too tends to, go contrary to these screening services and the information we're giving out there. And secondly, we develop a comprehensive campaign plans that outline our objectives, uh, our messaging strategies, like most most of these lower and middle income areas, language tends to be a barrier. So of course, you have to develop a strategy to ensure you're able to speak in a language that they will understand. Then various communication channels, and then timeline. We also create awareness campaign using various channels like the social media platforms, the traditional media platform like the TV. We've also been on radio. We've been on various online newspaper publication, community outreaches. We go as far as printing educational materials to ensure that we give out to these persons. And we do that sometimes. We do not just do that in English language. Like I said, we have to communicate to them at the barest minimum, the way they can understand what we're talking about. So we do as far as translating and writing in the language they can read and they can understand. So we focus more on raising an awareness about this issue, the risk factors, the vaccinations, the screening, and of course, not just telling them about this thing, because we also discovered most persons, some persons have heard about it, but you ask them, have you taken advantage of maybe the screening platforms, or have you gone for screening? Most times you get to hear them say no. So what we do, we create the awareness through different channels, and we also ensure that there are platforms through which we can point them to actually assess the screening. And most times we do that free of charge. So with our partnership and with our collaborations with hospitals, with organizations, community groups, local authorities, and other stakeholders, people like organizations like Nguvu Collective, who have really played a very great role in ensuring that we are amplifying, the solution. We are amplifying what we're doing here at Help the Woman campaign. So with such partnerships, we are able to reach out to them. We're able to also leverage our resources and expand uh, our reach.
Hi, Ituro. We can't hear you anymore. Hello, Ituro. Are you still there?
Hello?
Okay. Welcome back.
Okay,
Okay, so we
sorry, that
stopped
was
hearing you
network.
for some seconds. Okay.
Oh, okay, sorry about that. Okay, so we also organize trainings where we incorporate some of the community leaders to train them in some of the things we're talking about, so they are able to relate it to their people. We also provide screening services, and this we do by supporting existing facilities. Example is like in Akwa Ibom State, there is a hospital called the VVF Hospital. So we partner with hospitals like that and screen free of charge, and we ensure that these hospitals are able to take care of them throughout this exercise. And then we also implement effective follow-up mechanism. Like last on a particular in a particular area, we discovered that about 30% of the people who came out for the screening, about 30% of the people who came out for the screening did not come back for their results. Okay, so we had to sit back and re-strategize on how to, follow these people up and ensure that because what's the point coming to screen if you're not going to get the results? It's just like you did not do anything. So thank God I was able to reach out to an organization who are currently working on a technology that uh, shortens the timing between the period of taking samples, culturing, and of course the results coming out. So that has shortened that timing, and hopefully the machines will be deployed in some facilities, so it's possible to come screen and wait for your result. That way we are able to cope that. And lastly, monitoring and evaluation, and this we do continuously by monitoring our progress. This include the number of reach, the number of engagements, the uptake of the screening services that we are offering, and of course we adjust when necessary. Like I had said some time ago, we noticed that every time you mobilize people in a place, you speak to them, you talk to them about this. Sometimes there are people there who do not get to go back with anything, or sometimes they listen and the moment they step out of the hall or wherever you're gathering, uh, they forget what you had told them. So we developed a mechanism where we have a one-on-one interaction, and we also ensure that we put people they are comfortable with, mostly women who are able to relate with them, talk with them. And of course, when we did that, we noticed that the result was massive. So this has been the approach we are using. And of course, we are also leveraging on technology just to ensure that we are faster, we are swift, and we're able to cover a wider reach. Thank you.
Thank you very much, Itoro. That was quite exhaustive. It's good to see that you have the whole process well thought out from implementation, and that you're actively monitoring what you're doing. So, a question I would like to ask you is, because I know how it can be advocating for vaccine uptake, right, in communities, and where there is a truckload of misinformation spread in those communities. So, how are you able to navigate some of that? Please, just very quickly.
Sorry, can you take the question again?
Okay. So I asked how you're able to deal with navigating the misinformation around the vaccine in those communities.
Okay, okay. Yeah, and this, especially the vaccine. I remember last year, there's what we have different projects. We have, take for example, like the campus stores, which really was what gave me the shocker of the year when we got to one of the universities, and we saw the resistance from the people. Like we are talking to university students, we're talking to people in the sciences who are supposed to know or at least relate to what we're talking about, but then they were actually pushing us away. Okay, so mostly there are so many misconceptions from the vaccine will make you to be barren, from it can kill and all that. So what we try to do is to get the authorities, take for example from this part, we have church leaders who people look up to, we have stakeholders in communities who most of these people also look up to. We try to get them to understand the scope of what we're doing. Also for women, we talk to their husbands, because sometimes there are women that actually, their husband warns them from, coming for such healthcare services. So what we do, we include the men. We strategize on how to get them. Sometimes we have gaming session, and at breaks we're able to open them up to some of these truths. At that level, they help us to, demystify some of those misconceptions. It's actually working. Of course, it's not 100%, and we are still a work in progress. But so far, the progress has been commendable.
Okay, thank you very much, Itoro. So over to you, Innocent. Sorry you had to be away for so long due to network. You were talking to us about what the Funelani Nganeno is all about, and the prevalence of teenage pregnancies in your community, and how you're responding to that.
Yeah, sorry about that. I had to switch to my phone. I know we said laptops, but it wasn't working on my side. So, for me, I'm from Gomazin area in Gomazi called Mjejani. And then Jejani was redeveloped, and then I permanently started residing there in 2021. And as part of my journey in Jejani, it was so rural in such a way there was no public transportation. Um, Everything was far, like at least 30 k's from to your closest shopping center, and then 50 k's to your closest health facility, and that's at least, Then most people approach me for transportation to reach places like the hospital. So, but obviously, I'll go more on emergency services like taking people to the hospital. Most of the people that I was taking to the hospital, it started being young girls. By young, I mean 10. The youngest was 10 years old. In all my life, I've seen people in pain, someone who has been shot, someone who's close to losing a life. But, seeing a 10-year-old who's about to give birth in labor and then having labor pains, jumping up and down, turning around and not knowing what to do and what I can do, that devastated me. It like crushed me and it crushed my spirit, and I had to do something about it. And because of I'm someone who is a catalyst and believes in change, I've always believed that if we want a better society, if we want a better government, change needs to start with us. I started, also investigating these cases because they were happening more and more often, and saying, what happened to you? Why you are 10, and then no, you're pregnant? Were you raped? Were you forced? Did someone force themselves on you? And saying no, my boyfriend slept with me, and then we had a child. I'm saying, your boyfriend, how old is your boyfriend? It's like 25. I'm like, wow, 25. That's old enough to be a daddy girl. So then I explained, and then I started teaching those that I was around. I'm saying, do you know that this is wrong? And then actually you are not old enough to be interacting in any kind of sexual acts at the age that you are in, according to our government and our constitution. You're supposed to be in school, you're supposed to be in primary school and being focused on that. And surprising enough, they know that. And they will tell you that, but our parents have fixed it. And how did they fix it? Then they will tell us they've paid for Funelani Nganeno, which is a fine. The fine means if my daughter goes missing, we can come and find it at my house. What happens is I would go run about my business, meet a 10, 12-year-old that I would like. I can forcefully take her, I can propose her, I can manipulate her, I can do whatever to get her to my house. I would sleep with her, maybe impregnate her, and then take her back home to her parents with the elders of my family now to accompany me and say, hi guys, I have done you wrong. I've slept with your daughter, and I know that this is wrong, and I'm willing to pay for my punishment. So I'm willing to pay the fine called Funilani Nganeno. So next time when she gone missing, you know that she has made my house. Now, when we look at this thing, suddenly that child becomes the wife. Yet South Africa says that they are done with, there's no more child marriages, but yet in an informal way they are happening because of those children. They become wives. They don't only become sexual slave, but they become domesticated slave, whereby they have to start taking care of the boyfriend or the husband's family at the age of 10, and then all their future is lost and they forget about being a child in that instance. That's where I met a year ago. That's where I met Nguvu Collective, and then I signed up for their online program. And then since then, they've empowered me to be able to start a campaign whereby 10,500 signatures. The campaign was signed by 10,500 plus um, people, so believing and wanting the eradication of Funilani Nganeno. The reason I approached and then we partnered with Nguvu Collective is because of the traditional leaders and even the government, even the locals. They were denying this. They were saying Funilani Nganeno, there's no such thing. There's no 10-year-old who's giving birth. There was no, in Gomas, in Pumalanga, there were no stats. You would go to the hospital, would go to the clinic, would go to the school, you ask for stats, and then they say it's not them. Therefore, we decided to approach the Human Rights Commission, whereby we decided to approach the Human Rights Commission, whereby we with our petition and asking them to investigate the matter. And when they investigated the matter, it's when numbers starting to show. Sorry about that. Let me just close this. It's when numbers started to show and we were starting to have evidence of everything that was happening, and more and more people started getting involved and coming forward. That's the background of the story. So that's how my personal journey with this started. It's being a citizen and practicing the spirit of Ubuntu, trying to assist in the community where I can, and getting exposed to this.
Thank you very much, Innocent. Can
Very
you just
much
give us
innocent.
a?
Can you just give us a?
I think there's an echo.
I think there's an echo.
I'm sorry about that.
Okay. All right.
All right.
Okay. Innocent, can you turn off your
Innocent, can
audio
you
for
turn
a
off
bit?
your audio for a bit?
Yes.
Okay. All right. I think we're good. Thank you very much. So that literally kept me at the edge of my seat, because how do you, I mean, a 10-year-old, that's really appalling. Can you give us like the statistics, how many girls within that age range in your community get pregnant, say, yearly? Just a rough estimate.
Just a rough estimate.
Yeah, no, I do have actual numbers on everything that is recorded. So there's more than this. So now I'm going to give you stats for the last 3 months. So we can say from December, the festive season, until girls that gave between the ages 10 to 14 that gave birth in Ngomazi, it's 33 girls. 33 are between the ages of 13 to 14. And then the girls that gave birth between the ages of 15 to 19, there are 1,167. Those are the girls that gave birth to, they became mothers. So a 15 to 19 years old, 1,167 recorded around the Nkomazi district. And then these are the stats that we got from the Department of Health through the intervention of the Human Rights Commission. And all these cases are going to be investigated. Yeah, there are some cases whereby it was a 15-year-old to a 15-year-old. But study further said that when most of these girls out of 10, they were being tested for HIV and AIDS, they said that let's say if they tested 10 girls and 10 boys, they would find that 7 of the females will be positive and only 3 of the girls, 3 of the boys will be found positive. And then it means someone who is older, an older generation, is the one that is taking advantage of these young girls. And that's why each and every case that I've spoken about is being investigated as we speak through the intervention of the South African Human Rights Commission.
Thank you very much, Innocent.
Thank you very
So,
much,
what
Innocent.
exactly
So,
are
what
you?
exactly are you?
Okay. Innocent, can you turn off your audio?
Innocent, can you turn off your audio a bit?
Okay, thank you. So, how exactly have you tried to address this? What is your campaign about, and how are you addressing this specifically?
The first thing is awareness, because there are those that who are aware that this is a social ill, and there are those who are not aware that this is wrong. So the first address for you to address an issue is to educate the community. Then so far had 8 community engagements to our filling town halls and educating the community about Funelani Nganeno and their rights when it comes to, especially school children, when it comes to sexual activities and their bodies. Um, through this community initiatives, we have managed to have multiple stakeholders from your Department of Health, the Department of Social Services, the South African Police Service, National Prosecuting Authority, private investigators, Section 21 of female advocates, and a couple of other entities that I wouldn't count all of them that have come together to eradicate fighting Funelani Ngalendo. So we are addressing it by education. That's one. And then number two, it's awareness. And number three is following up on these cases and going up after the perpetrators. Even though it's hard, a lot of people, they don't want to come forward and confess to being in the wrong or to say that they were wrong because they feel shame. The most dangerous thing that happens is that there's always secondary victimization, whereby if a 10-year-old would come and say, I was raped, they'll say, what were you do you not sex? You're just 10.
Hi,
Um,
Innocent. Sorry to
Hi,
cut in.
Innocent. Sorry.
yeah.
There's a
Sorry to cut
sound
in.
coming from your
There's
end.
a sound coming from your end.
Can you still hear me? Hear it now?
No, no.
No, no.
Okay. Yeah. The biggest issue is secondary victimization, whereby yo, this okay, cool. So as I was saying, a lot of people are afraid to come forward because of they're afraid of secondary victimization. If someone comes and say I was raped and I'm 10, the first question that adults would ask some of them is like, what were you doing? What do you even know about sex? It's your fault. And we are trying to educate parents to be understanding and to be loving and to be nurturing as parents and to understand what happened, and to follow up and to support their children through thick and thin and be there as parents. And they mustn't say this has also happened to me, therefore it was bound to happen to you. But change starts with them, change starts with their generation. They cannot allow this to happen for generation to generation because of it has happened with them. Um, that's one of the interventions that we have been doing through community engagements and Google Collective.
Thank you very much, Innocent.
Thank you very much, Innocent.
Please, your audio again.
Is your audio again?
Mhm.
Thank you. Thank you. So it's really sad to hear all of this because it's not just a community problem. It's not just a South African problem. It's everywhere on the continent. It's in Nigeria, not just in the north, in the south. We see this happen over and over again. Child marriages, prevalence of VVF as a result of little children. I mean, a 10-year-old is a child. She should be in primary school, and getting her pregnant, you've practically taken away her childhood from her. She can't be a child anymore, right? She becomes a mother at 10, and that is really sad. And I'm glad to see that you took the initiative to address that in your community, and we hope that other people in other countries and other communities can also do similar things, and at some point would be able to eradicate this completely. Thank you. So moving on to Deborah, what is the greatest challenge you'd say? So this is a question from the chat box, and also to note that you can start sending in your questions into the chat box if you need more clarity on what our change makers have talked about so far. Because we hope that from this conversation, journalists would write stories based on this. And like Deborah mentioned when we started this call, there's going to be an announcement at the end of the call, still related to the story writing. So over to you, Deborah. What is the greatest challenge you say that you faced, and how have you been able to navigate this?
So the biggest challenge that I've noticed when advocating for patients' rights committees is bureaucracies. There's a lot of protocols that are needed. Walk into, you're directed to a different office, and it goes on and on. And there's no basically any singular body that has so far, come out and said, okay, Deborah, we got this and we're going to implement this. So there's a lot of bureaucracy involved. Um, there's also the challenge that I face from, reaching out to also people. I've garnered support so far, but not as much as I would want, because I believe that advocacy, you need as much people involved as people. So I'm still looking at, writing out emails to politicians, writing out emails to people I see as could be potential decision makers, and asking for advice on how to go about this. So sometimes I don't get a response back. I deliver hand letters to officers. I don't get, feedback. So that's a challenge. It can be demotivating sometimes, but I keep on going. And another challenge that I can say is that patients don't actually know their rights. So most patients
Hmm.
do not know their rights. Those that I've interacted with, you ask them about maybe an experience in their life, just randomly, and they'll tell you something outrageous, and you ask them, "Did you report this?" Uh, they look confused, like, "I didn't even know I could report that. I thought that's normal, like that's what you go through, especially in public hospitals." Like, the standards that people are used to has made them believe that that's how it should be. So even when pushing for these bodies that will help to protect patients' rights, the patients themselves don't know their rights, and it would really help if people knew, because self advocacy also, championing your own rights. If people came out and said, no, we do not accept this kind of treatment anymore. If you do this to me, I will take action. It also helps with the process. So we've been trying to educate by interacting with people through my initiative once again, the Debra Show, having interactions and trying to educate people on their rights. We have 14 rights in the Patients' Rights Charter, 2013 edition of Kenya. So, and they're very very comprehensive, these rights. You find that people don't even know what that is. They've never heard of that before. So that's also a challenge that I've faced. And another that I foresee is that being in the healthcare space myself, it might look like I'm fighting organizations or institutions. Why are you fighting your fellow colleagues? you know. But I also understand that it's not everyone in this healthcare space who is negligent, perhaps, or who is dismissive, because otherwise the healthcare system would have collapsed. So just to keep these few people in check, we need to have such systems in place to avoid, generalizing that, all nurses are so rude, or all doctors don't know what they're doing just because you had one misdiagnosis incident with one person who clearly didn't know what they were doing. So there's also that thin line to know what's happening and what's not. There's also the factor of our hospitals where, especially public hospitals, short-staffed. Sometimes the equipment are not really, enough, and you can only do so much with what you have. So to someone, it might be perceived as you being negligent or you're infringing on their rights. So so we need to understand both sides. But at the end of the day, even if that's a challenge, it doesn't rule out the fact that we have these cases and they need to be solved, because so many people come out with stories on how an error that was preventable led to a devastating outcome or irreversible outcome. So I'm just one of the few people that have undergone this, and yeah, even if there are challenges, we're still pushing forward. Yeah.
Thank you very much, Deborah. So over to you, Itoro. Same question. What is the biggest challenge you've experienced, and how were you able to navigate this?
Okay, thank you. What has really stood out for me as a challenge has been we have a more number of people coming out, for screening, and then we are not having enough manpower to be able to cater for them. And remember the last screening, we actually we partnered with VVF. We also partnered with University of Uyo Teaching Hospital. The turnout was very massive, and the collectibles, the materials we actually use, finished. Okay, and these people actually came out from 8 a.m. At around 2, the materials finished. They had to wait. We had to come back to town, come get materials. Went back. We still exhausted it, and we still had more persons who still waited for that to happen. So sometimes we are having a limited resources to be able to get enough materials and enough manpower to actually meet up with the number of persons that are coming out for the screening. Another challenge too has to do with the husbands of most of these women who are really ignorant about what we are talking about, and most times they stop their spouse from coming to access these particular services. So sometimes you we have to just see how, like I had said earlier on, we incorporate them, we bring the male. Of course, we have to gather them uh, using what interests them to actually share what we are doing, just to get them to approve their spouse coming to receive this treatment. So another is protocols, trying to reach out to your DMs, people who can actually. I remember we are currently still in touch with the state government because there's a project we're supposed to carry on this quarter to actually screen about 1,000 women. And we started, pursuing that since last year and up till now. Stories upon stories and all that. So this also, in a way, hinders the speed at which we want to reach out to these persons. This has really been the major challenges, but we've also tried to see how we navigate through all these. Most times I have to fund the whole project. Thank God for Nguvu Collective, who has really been supportive. I had a very important call in Abuja yesterday, but of course we are preparing for a project, so I needed to weigh both options, and I had to just waive the call just to be able to carry on with the project we've already budgeted for this month. So with enough resources, both manpower, materials, and all that, we're able to reach out to these women. We're able to give them these services that, of course, will help them to live cervical cancer free life. But on the whole, we're still pushing, and we're trusting that we are able to get through all these hurdles.
Thank you very much, Itoro. And we're now racing against time. So just quick question,
You're
just a
muted.
follow up to. Am I muted? Can you hear me? Can you?
You, I
Okay.
can.
Okay. Thank you. So just a follow up to that. Evidence. What impact have has your work been able to gain so far? I mean, you've been doing it for quite a while. Just a story that
Yeah.
shows that it's been impactful.
Okay.
Quickly, please. Very
All right.
quickly.
So we celebrated our second anniversary last year, November. So over the past 2 years, we've been able to screen over 500 women free of charge.
Hmm.
We also give out healthcare products. We've done that to over 800 women. We've also been able to reach in terms of awareness creation, in terms of reaching out with educational materials to 8,000 women and girls. And on social media and other media platforms, we've done over 25,000. Uh, Last year, like I said, I wrote a petition to the federal government through the Primary Healthcare Development Agency, asking them to include HPV vaccine in our national immunization program. And that was launched on the 24th of October 2023. So the first pilot page in 16 states had already been rolled out, and May 2024, that's after April, the others will also be rolled out. And we've been on several media platforms through the help of Google Collective, like Silverbird, TVC, Plus TV, news channels, XLFM, and Nigerian Info, and so many others, just to amplify, what we're doing, just to reach out to more persons. And we've done a lot of training. We've sent We have had calls from John Hopkins Hospital, US, calling in to support what we're doing in trainings. We've also a stakeholder with King's College London. Okay, so this has happened as a result of what we're doing, and several others. Of course, I can't mention everything here, but I like to say a very big thank you to Nguvu Collective, who have really helped to amplify what we're doing. Yeah, so let me just stop there because of time. You're muted.
Yes, I just realized. So thank you very much. It's good. It's good. It's really good to know to hear some of these impactful stories from what you've done so far. And of course, in Nigeria, we know that the HPV vaccine was rolled out last year in October, and now we're expecting a second rollout in May, and which is great to see that what you're doing has been able to feed into that somehow. And kudos to you. So over to Innocent. Innocent, I believe you're still there. Can you just turn on your video? Okay, yes, you're still there.
You just
So
not
what?
you there. So what?
Please turn off your audio so I can
Please turn
hear.
off
So you
your
can hear
audio
me.
so I can hear. So you can.
Okay, thank you. So you already mentioned while you were, when you were speaking earlier, how the leaders, the policymakers, they don't even recognize this as a problem, and which is a huge problem really, if they don't even see it as an issue to tackle in the first place. But then aside this, what has been the biggest challenge, the major challenge you've experienced? How have you been able to navigate this? And possibly tell us one story from your work so far with this girl. What particular story has stood out for you since you've been carrying out this work? Was that I hope I was clear
Was
enough.
that? I hope I was clear enough. Yeah, you spoke about challenges and the story that made the most impact. So first of all, I'd say challenges is resources. Um, uh, Fortunately, we do have Nguvu Collective that has sponsored most of the trips. Like today, I have to go and do another documentary. So obviously, that is for awareness. Resources and being able to accommodate everyone who comes to you, because at the end of the day, I'm just one man, and there's over 1,167 girls. Like I've said, since I've started this, I've only managed to meet between 20 to 30, victims. And each and every day I hear of more, but I cannot reach out to them because, like I said, I am just one man. So I'd say resources, and secondly, a safe haven for these girls, because there were some that would come to you, but when they do come to you for assistance, they want you to take like full responsibility. They say, you know what, I've left my husband and I came for you for help, and then where can you take me? It's unfortunate that there's other stakeholders who need to come and play ball, but they don't. Instead of coming to play ball and help us. They'll tell you about personal problems. They'll tell you that the government doesn't have enough resources. Where am I going to take this person this time of night? Then they end up becoming your responsibility. A sad story that I've heard, and then that still touches me, and I feel that somehow uh, there's no justice to the lady that I'm going to speak about, because of I haven't managed to find a way to really help her. It's where one of a young girl who came forward and said that she's prostituting herself. She's 13 now, or 14. So she's prostituting herself, and then she's initiated some of her friends. But the way that this started, it's her grandmother gave her over to her grandfather to sleep with her. And she tried to go to the community. She tried to go to community leaders. She tried going to the police. She tried to go to a lot of people for help, but she wasn't helped. And then when she came to me and says, "I believe that you can help me. No, I want to change. I don't want to be this person that I am. I've resolved to this because there's nothing else I can do now. I'm expected to do this. I do it at home, and I come back and I do it here." So that story, each and every night, it haunts me. Somehow, some way, somehow, um, justice needs to be found for that girl. She needs to find a home where she can be a child, instead of an adult, a home whereby she will not be charged and be seen as an object of something, of making money, or satisfying the grandfather, since the grandmother cannot.
Hello, Innocent.
Hello, Sonia.
Hello,
Still there?
Innocent.
Can hear you.
Okay.
Yes, you're here.
Thank you. Thank you so much for sharing that. It's again heartbreaking to say the least. So, moving on, we have about 14 minutes to be done with this. Again, um, participants, you can leave your questions in the chat box and the guest will respond to them. So, what would you say about your response? What is that secret ingredient that you think has made it work, that has made it successful, that other people can learn from? So, first, this question is to Deborah. What is different? What makes your response stand out that other people can learn from?
Okay, I believe that we can all turn something negative to positive. And, when you take something personally, even if it didn't occur to you per se, but it happened to someone and you empathize and you take it like something that has affected you, there is power in that because you can channel that into advocating and trying to get reformed policies. Um, so there is really power in, you know, living in the story that you're trying to change or to sell. You need to be the face of your advocacy. You can't just, start something and drop it midway because you lacked motivation or something. So I believe that one thing that has kept me going so far, um, I mean, apart from that, is having support from Nguvu Collective organization, from family, from friends, from other professional colleagues. So garnering support, people you can talk to remind you if when you forget why you started this in the first place and why it has to be you to run that. Because if we all sit and wait for someone else to do it, perhaps no one else will. So sometimes it might seem like it's pointless what you're doing once you get all these rejections and the challenges and all that. But then you remember that everything starts from somewhere. You can build from the ground up. So the advocacy and all that, talking about creating awareness, it's important also. So not giving up and just staying focused, knowing that we can be the champions of the change that we want to see. um, we can all make a difference, basically. So that's what has kept me going so far. And I believe the little success that I've had, that I celebrate, the milestones that I've had, um, are due to being in that mind space that I'm the person for the job. I will not wait for someone else. Yeah.
Thank you very much, Deborah. So, Itori, there's a question for you in the chat box. I'm just going to read it out. So he said, this is from Paul. He said, when discussing the impact of your initiative, you mentioned the introduction of the HPV vaccine in Nigeria as one of your success stories. And he would like to know how you were able to directly correlate your initiative's effort to that impact, considering that there are several others involved in the campaign for HPV vaccination in Nigeria long before your initiative started. So that's from Paul. Itoro, did you get that question?
Okay, yeah, I did. Of course, it was not solely my efforts that actually made that come into limelight, but um, I was able to get thousands of persons to actually sign the petition. I was also I wrote directly to the DG of the Nigerian Healthcare Development Agency. We had a live interview. We talked about that. I wrote to him. He acknowledged. Uh, and also I was able to use several media houses just to push the drive. But of course, there are several other persons, like I'm a member of the Nigerian Cancer Society. So there are other people, stakeholders too, who are also driving for this. So I can't say it was only my efforts that made that happen, but of course, in a way, we were able to contribute to make that happen.
Thank you very much, Itoro. Paul, I hope that answers your question. And so over to you, Innocent. Finally, this should be the last question from my end. Innocent, what would you say about your response that made it different and other people can learn from? Innocent, are you there? Okay. Okay.
Yes, I'm here. Sorry, I missed your question, Sonia.
So I simply asked what makes your response, the approach to your response different, and what can other people learn from it? What do you think has helped your approach to be successful, and how can others learn from it?
I wouldn't say my approach is different because of the people that were supposed to be playing a role. Well, I am the people also. No one was doing it. No one was advocating for these young girls. If they were going to school where they are supposed to be protected by teachers, or going to the hospital whereby they are supposed to be protected by healthcare workers and doctors, I that my approach was, I was saying, enough is enough. I mean, you are healthcare professionals and you know what's right and what's wrong. You've all been trained. You have degrees in this. And so my approach is unique. And what has kept me going is persistence, because I believe that I'm a human for a reason. The reason I'm born as a human being is so that I'm not only responsible for myself, but I'm also responsible for my society. Change begins with me. If I want to see change, if I want to see a better community and a better society, I need to be the catalyst. It needs to start with me. I cannot expect you to be different, or I cannot expect to have a better community whilst I'm not doing anything about it. What have I done to impact my community? I cannot um, always my hand is always open to receive help, but I cannot be able to help others. And that has been my motto, persistence, and most importantly, the spirit of Ubuntu that was installed to me by my grandmother and my mother, whereby we are human because of other humans. Imagine if you're the only human that existed on this planet, what purpose would you serve? So the reason we are together on this planet, in this world, with other human beings, is so that we can have a society and communities and build a way for the future and for all those that are going to come. And when we are saying we cannot have our young girls who are leaders of tomorrow getting impregnated and getting infected by sickness and disease, getting mentally abused and being used and exploited, and all those words, we cannot stand by because of what will become of our future and of our tomorrow. I don't only see South Africa today, but I also see the South Africa tomorrow. I also see what kind of Africa will it be tomorrow? When I close my eyes and imagine of an Africa tomorrow, I can see all those problems, and this is one of the problems that we as a society we face. Um, I hope I've managed to answer your question, Sonia.
Thank you very much, Innocent. Innocent. I like what you said there. We're humans because of other human beings, and we can all just fold our arms and expect that the change we need will happen magically. And I commend you, Itoro, I commend Innocent, and I commend Deborah for the work you're doing in your various countries. Um, yeah, we still have participants. Okay, I think there is something on the chat in the chat box. Okay, last question, I hope. This is from Dana, and she said this question is for Deborah. And she says, have you ever faced threats or pushback from colleagues in the health sector during your advocacy efforts? And if yes, how were you able to handle it and not allow it to deter your advocacy efforts? Deborah, did you get that?
Yes, I got that. If I've experienced threats or pushback from colleagues, not really, I have not experienced any threats directly from my colleagues. What I can say has come close to a pushback is when interacting with fellow healthcare professionals, and I bring up what I'm doing. And the feedback varies sometimes. Some people are totally for it, others just wonder, "Wait, what are you doing? You're a nurse yourself, so do you feel like you're better than all other nurses in Kenya? Or perhaps you feel like you're the only one that's doing the right thing." It looks like I'm trying to fight other people by claiming that basically all other healthcare workers are not doing the right thing. Sometimes it can be misunderstood in that way, but for someone to be having that conversation and actually express such concerns, it means we're just having a conversation. So I try to clarify and explain where I'm coming from and why I really believe that it's a problem in the healthcare system, and we can't just look the other way, trying to find excuses for people, trying to claim, this and this happened because of this and that. So I try to engage further and explain, but yeah, so that's what basically has happened before.
Thank you very much, Deborah. I hope that answers your question. So I'm glad we were able to keep to time, and thank you for the quality of conversations we had here. Thank you, Innocent. Thank you, Itoro. Thank you, Deborah, and of course, thank you, Nguvu Collective, for making this work, for making this happen, for bringing us in contact with these amazing change makers in Kenya, South Africa, and in Nigeria. And we hope that, again, from this conversation, would have journalists writing about these stories to amplify it. And then ultimately, would have a society where no one is wrongly diagnosed and no one has to die from misdiagnosis of their ailments. We're glad we have Deborah, but not so many people have been lucky to still be alive to tell the story. So we hope we can get a world where that is totally eradicated and our healthcare system is improved. We hope we can get a world where no woman has to die of cervical cancer, and of course that no girl's childhood has to be taken away from her by people that are supposed to protect them. So thank you very much for staying here with us. Thank you to our audience for listening. Thank you for the questions that came in. And that will be all from me. Over to Chibuike, the senior programs manager, Nigeria Health Watch. Over to you, Chibuike. Thank you very much, everybody.
Okay. Hello, everyone. Good evening, good afternoon, depending on where you're coming in from. Thank you so much for that beautiful conversation. I really enjoyed listening to you all, learning about the work that you did, how you are approaching different social issues from your countries. And I hope our colleagues who are in the room were also inspired, and with the questions that they asked, hopefully they will be following up to learn more about your work and helping to amplify those interventions, because essentially that's why we conceived this idea, this session. It's as a result of the Solution Journalism Africa initiative that my colleague mentioned at the beginning. Trying to get journalists to realize that beyond all of the issues that we have, of course, you can't deny those. They are quite alright, but beyond that, there are still individuals, just like Innocent, Deborah, Itoro, who are doing their bits, not a one size fits all. There's always room for improvement and all, but they're doing their bit to address those problems. So this is just an effort of us trying to bring those change makers in touch with journalists, because like we say when we talk about solution journalism, problems will always scream. Problems are screaming, they're always in our faces all the time, but the solutions, they do whisper. So they need more effort, they need more, being more deliberate, being more intentional to amplify them, to put them out there. And that's what this meet a change maker session is about, helping to amplify and scream those things that are working, so we can learn about them, amplify them, and hopefully scale them, so others can can learn as well. So yeah, really thank you so much. And to encourage that drum roll. So the big announcement that we talked about earlier, so to really encourage, colleagues taking up these stories, because we didn't want it to end this with this conversation. Yes, we have about 20 some 30 some people joining on Riverside in spite of the challenges. Thank you so much, because Riverside is not as straightforward as Zoom that everybody is familiar with. But we still felt it had a better recording quality, so that's why we just decided to try, stick to it. But in spite of that, people still joined, and a couple of people joined via the live stream on YouTube. But we want that to go beyond that. Most of the people that joined were journalists. Some are people who work in the development space, maybe as program managers, or some other roles. But we want these stories to be out there. Yeah, that's the real essence of this. So you hear these stories. Of course, you can't learn everything about them in 1 hour or 30 minutes that this conversation lasted. So we want you to follow up with them. We are happy to make those connections. Thanks to Nguvu Collective that helped convene these change makers that we spoke with today. But we'll still be working with other change makers in subsequent editions. So we want you to reach out to them, ask further questions, investigate, because a lot of times when you talk about investigative journalism, people think it's all about finding what is not working. But solution journalism is also investigative. You are trying to understand the issue and how they are addressing that issue. So please, we want you to reach out to them, dig in deeper into the issue and how they are addressing the issue, and eventually do stories. Of course, solution stories can take multiple formats. You can do your stories in audio, video, text, and we are here to support that. That's why Nigeria Health Watch is here. That's part of the Solution Journalism Africa initiative. Like I said, if you need to reach out to any of them, we are very happy to make that connection. You can so maybe you can just put your email in the chat. So if you want to connect to any of them, also put the email address of Ebenezer. Ebenezer is the senior partnerships lead at Nguvu Collective. He's in the audience, so he's not able to speak, but you can drop his email in the chat as well. So if you want to reach out to any of the change leaders, please do reach out and dig in deeper. Like I said, you can do separate stories for all the different issues that they are trying to address, so policymakers can learn, so that even leaders of non-profits can learn that this is what people are doing, this is what young people are doing to address issues in their communities. Who knows, maybe they will help in amplifying or scaling up those interventions, but in our own bit too, to encourage that to happen, because we understand how it can be difficult to get funding supports to do that. So we have a mini grant that we are announcing. So the big announcement that my colleague talked about at the beginning, Dabri. So we're happy to say that if you have those story ideas that you want to follow up based on the conversations we've had today, if there's one person that you want to dig in deeper into what they are doing, say Innocent from South Africa, Deborah, addressing the issue of misdiagnosis in Kenya and raising awareness about it, or Itoro on the issues around HPV in Nigeria, and you want to follow up with them and do stories, reach out to us. We'll put a link in the chat now as we round off. So reach out to us, just a few details. Tell us what you want to do, who you want to reach out to, what you want to know extra, or your approach to doing that. So we look at some of the ideas and select 3 persons and give them a seed grant. Not too much, but hopefully that's enough encouragement for you to also follow up and amplify these stories. So yeah, that's the announcement. I don't want to say the amount, but like I said, it's something good that we help you follow up and do these stories. And yeah, you can tell us when we now engage with you. If you are a freelancer, it's fine. If you are attached to a media organization, you're going to publish in your media organization, that's fine. If you're a freelancer, we can also help you reach out to our network, find a reputable platform where you can publish the story after you're done with it. But yeah, thank you so much, and that will be the announcement from my end. Over to Sonia again to round off the call.
Okay, thank you very much, Chibuke, for that. And again, thank you to everyone that has joined. Thank you to our guests. Thank you, Innocent Madisela from South Africa. Thank you, Deborah Munari from Kenya. And thank you, Ituro Suru from Nigeria. It was really great to have you on this call. I appreciate the quality of conversations we had, and I appreciate what you're doing in your various communities and your various countries to address the societal problems that we're plagued with. And we hope that we would get more people, more change makers come out from this conversation that we've had. We hope that the conversation we've had would give people insights on what can be done regarding the social issues in their communities. So, thank you to everyone who joined us. Thank you to our listeners on Riverside, on YouTube, and on Facebook. And of course, there's going to be another episode. This is not the only Meet a Changemaker series, right? We're going to have other episodes, and we would communicate that in due time. So thank you very much. Have a nice day, everybody. Thank you guys for joining. Thank you so much. Bye.